And now I'm talking to Breda Gahan, the Concern Worldwide Global HIV and AIDS Advisor. Breda, how's it going?
Hi Darren, good to have you back again. Nice to speak to you.
Thanks, Breda. Breda, in July, the latest international conference was held in Durban in South Africa. You were at that conference, and I spoke to you shortly after you came back from it. Well, last month there was a feedback session held here in Dublin on the conference. Can you tell us, please, who else was at the feedback session? Who organised it? And could you tell us the main points you got out of the session, please?
Thanks, Darren. Yes, we were delighted to organise the AIDS 2016 feedback session with the Dóchas HIV and AIDS Working Group, of which I'm a member, the Irish Forum for Global Health, Trócaire, Concern, the Mater Hospital, and the Centre for Global Health, where the session was facilitated. We were delighted Dr. Jack Lambert from the Mater Hospital, who's the lead consultant on HIV response, was able to speak.
In Ireland or in the Mater?
In the Mater Hospital.
Okay, yeah.
In the Mater Hospital. Deirdre Campbell, who's the gender-based violence and HIV advisor from Trócaire, gave her feedback. I spoke on behalf of Concern and with reference to the Dóchas HIV and AIDS Working Group. We had a response from James O'Connor, a peer advocacy strategic consultant working on HIV and living with HIV, feedback from his perspective. And we were delighted that Vincent Marr was able to speak on behalf of Irish Aid, and he participated at the concert.
You forwarded me on two PowerPoint presentations from the feedback session, your presentation and the presentation by Dr. Jack Lambert. To talk about your presentation first, the two main startling points that stuck out to me from reading it is the number of people with HIV or AIDS internationally who are not on treatment. I think the figure is unbelievable, and you can talk about that more if you want. And also the second thing is the plight of nurses, midwives and community healthcare workers, or CHWs for short as you call them, in developing countries. And later on maybe we can talk about Ireland as well. But do you want to just talk about the global picture as regards the number of people who are and who are not on treatment for HIV or AIDS, and the plight? What is the plight? Because most people in Ireland probably don't know this. Like, what is the plight of nurses, midwives and community healthcare workers in developing countries, please?
Yes, Darren. Well, it is stunning, although we like to look at the glass is half full. 36.7 million people globally are living with HIV at the end of 2015. Up to 17 million people are currently on treatment, which is great. They are getting life survival treatment that keeps them alive, functioning, being able to be parents and doing their work. Unfortunately, more than 19 million people are still unreached with treatment. They have never been tested, diagnosed, counselled and put on treatment for life. They will ultimately die if they don't get tested and treat. And many people at the international conference spoke of the importance to test and treat. That's the World Health Organization directive right now. And we in the Dóchas HIV and AIDS Working Group, in Concern, Trócaire, Irish Forum for Global Health, all support an increasing emphasis on HIV prevention. And we're happy that the theme for the World AIDS Day coming up in December, on the 1st of December this year, is prevention, increasing HIV prevention.
Yeah, and just the percentage-wise figures really hit home to me as regards the 17 million people on treatment. That only constitutes like 42% of people, is it? That out of all the people who have HIV are on treatment. So more people who have HIV are not on treatment than are on treatment internationally. That's true, isn't it?
That's unfortunately true. And still the most unreached tend to be the extreme poor, Concern's target population. The people being left behind include slum dwellers, people in remote rural areas, poorest people who have no access to testing and treatment, and weak health systems where there is no capacity to test and treat. There's still a high stigma for people living with HIV. And during my last trips in concern to Mozambique and Ethiopia. Many people there now say only poor people get HIV because they do not see richer people getting what they used to see in the past and call slim disease. It's extremely poor people who are being left behind. And among the 12 key population groups, extremely poor people could be among any of them in terms of pregnant woman, a child, a father, a migrant, a refugee. But increasingly, I think that the extreme poor are so important they need to be mentioned as a specific group being left behind. 12 plus 1. 12 key populations plus the extreme poor being left behind, not accessing HIV testing and life-saving antiretroviral drugs.
And there's something like 1 billion extreme poor people in the world, isn't there?
That's right, often exacerbated by hunger and other extreme poverty issues. And often we say, food is the first medicine. If we can get people to be healthy, food firstly will boost the immune system, even in locations where ARVs aren't readily available right now. And you asked me about the importance of nurses and community health workers. And this can really help the reach of testing and treatment and helping people to comply with their treatment. This is the first conference I was at where the nurses engaged in the response, myself included, when I worked in St. James's Hospital before I joined Concern. There was a 2-day pre-nursing conference, HIV related, July the 16th and 17th, around the themes of access, equity and rights now. And by empowering and training nurses, we can reach a lot more people in terms of HIV testing and treatment. Nurses have been hugely responsible for the increased access and coverage of HIV treatment in South Africa. They've got what's called the NEMART program, Nurse Initiated Management of ART. Likewise, community health workers tend to have great trust in all of the communities and countries where organisations like Trócaire and Concern work. Community health workers tend to be known in their community, trusted, and it's very important that they're empowered, at least in terms of how HIV is spread, transmitted, how it's not transmitted, and how people can protect themselves. They can reach people with the accurate information, and we need to resource community health workers. It was very sad to see the community health workers mock-up graveyard, which actually reminded me of what I was seeing when Ebola was impacting in Sierra Leone and Liberia, where Concern was supporting the safe burial programs. The poster they had up at this graveyard in Durban was discarded and disregarded community health workers in South Africa. We need to protect and support and pay and supervise community health workers. Extremely poor health workers can't be expected to be volunteers when they need to have an income to feed their families and get their kids to school. We also need to work with community health workers and nurses to end the HIV stigma and discrimination that still persists in urban poor and rural poor areas. It's not over yet. And I think I just mentioned to you before we started that I happened to look up the statistics in Ireland today, and I see this year alone over 400 new cases have been diagnosed in Ireland. 403 new HIV diagnoses until yesterday's report, the 12th of October. That's more than 57 cases up on the same period last year. So we're at week 40 this year in Ireland and 403 new HIV diagnoses. Now, fortunately for people in Ireland, testing means they're on the road to access free treatment for life. It's not the same in terms of the inequality and disadvantages faced by the extreme poor in developing countries where Concern and Trócaire and other organisations work.
Okay, we can come back to Ireland in a few minutes. I read an article you sent me about community health workers in South Africa. What happened? A lot of them recently got arrested or something. Did something like that happen?
That's right. Community health workers, unfortunately, they're now being supported by the Treatment Action Campaign and another local NGO in South Africa, Section 27. when they engaged in a night vigil outside the Free State office looking for rights, acknowledgement, an increase in their stipend, they were arrested and charged with violating the Regulation of Gathering Act 205 of 1993. Later, they were suspended with penalties on condition of not reoffending. So, but thankfully, the Ministry of Health in South Africa, the Director General in the Free State, is now supporting community health workers and understanding their personal hardship and life-threatening working conditions. I mean, we saw it with Ebola. Their irregular and insufficient pay. A world without community health workers means certain death for many patients who have little access to quality healthcare. And this is exactly the situation where Concern is working in countries from Afghanistan to South Sudan. Functioning health systems are hard to come by for safe vaccination, for safe delivery, for safe testing and treatment of HIV.
And the nurses and the midwives and the community healthcare workers in general have to be paid well for what they do. Just another question on the global situation. Like, say if you have HIV and you're living in you're an extreme poor person and you're living in an isolated region, and there's no health centre near you, and you haven't been tested and you have HIV, how long does it take before the person starts showing symptoms like that would make them think maybe I should get tested? Like, is it a few months or years or?
In Ireland, because of generally good diet, clean water sanitation, lack of mosquitoes and other infectious diseases that we see in poorest countries, a person might not notice anything until maybe they started losing weight, appetite, get some skin infections, a fever, a cough or a cold that turns into flu more quickly. They might think it was the flu or some other annoying illness based on weather. And unfortunately, a number of people in Ireland last year, I think it was 29 people, were diagnosed at the time they already had symptoms of AIDS. Late diagnosis is an issue in Ireland and in many countries. A person in a poor country where the water sanitation situation is poor, where there's malaria, other infectious diseases including cholera, lack of a good diet, hunger is persisting, people will get sick and die more quickly. Many times they will die and nobody will ever know they died of AIDS. They will report they're dying from TB or malaria.
So I think, is it 10 years that it usually takes someone who hasn't been, who isn't on treatment to go from HIV to AIDS in Ireland?
In Ireland, it can be 8 to 10 years. Everybody is different, and it really depends on the person's immune system and the amount of virus in their body and the strength of the immune system in terms of CD4 count. Just like cancer, no two people are the same. In terms of HIV, no two people are the same. There are different subtypes of the virus and different clades. And likewise in Africa and in Asia, different people have different responses. So it really is important, and we would advocate in the Dóchas HIV and AIDS working group that everybody would test annually, just like you have a dental check or for women a smear check, that it would become as routine as having a dental check in terms of testing for sexually transmitted infections. All of them have implications beyond HIV in terms of infertility and loss of productivity and just worry, the worried well. If somebody thinks there's something wrong with them, it's always better to know. Then we can do something about it. Early diagnosis, I'm a nurse midwife. In everything, early diagnosis is best. And it's similar for HIV and AIDS.
And just last question on this topic. If you don't know you have HIV, and then after a few years you start to develop the symptoms of AIDS, and then you get tested and you have the illness and you get treatment, like how likely is it that the kind of process of getting AIDS would be reversed, or is that possible?
Highly likely in Ireland, where the treatment is of very high quality now, less toxic than in the early days when treatment was initiated. We've first and second line treatment regimes. Some people are living positively on one combination pill per day with good nutrition, clean water, clean sanitation, and living a healthy lifestyle. People living with HIV in Ireland have the same or can have the same life expectancy as anybody else. We're more likely to die of a heart disease, car accident, obesity-related illnesses, mental health issues, or something else. Thankfully, the treatment works. We know it works. The big issue for us now who spoke at the conference, and Dr. Lambert mentioned the same, we're trying to get to the 90-90-90 targets. 90% of people diagnosed with HIV, 90% of those diagnosed to be on treatment, and 90% of those on treatment to have suppressed levels of HIV virus in their bodies. Sadly, HIV and AIDS remains the leading cause of death among 10 to 19-year-olds in Africa. Dr. Jack Lambert has been supporting projects in South Africa and understands the differences and mentioned the inequality in terms of diagnosis and prognosis in the northern countries where we live in Ireland and Europe, and in southern countries. And it's not right that the funding, hasn't been allocated commensurate to the need to end AIDS by 2020 and HIV transmission by 2030. We need to do more. I'm glad that Ireland has contributed and is still contributing to the Global Fund, and just at the replenishment meeting in September it was in Canada, hosted by the new Prime Minister there, Minister Trudeau, Ireland has allocated $30 million for 2017 through to 2019. So that's about $10 million per year. China, for the first time, is donating funding. And increasingly, countries in the south are supporting their own response. In a small way, Zimbabwe, Zambia, South Africa, certainly, Senegal, Thailand increasingly is supporting. So we need to support countries in the south to deliver on what's called the Abuja Declaration, that they will allocate 15% of their GNP for health and health system strengthening. Increasingly in Concern, we're integrating the HIV response into the health response in terms of health system strengthening and community health system strengthening. Supporting people to get tested and know their diagnosis, and supporting the delivery side, the health workers, including nurses, doctors, midwives, and community health workers to safely deliver testing, treatment, ART, and supporting compliance. It's difficult for some people based on their locations, travel costs, lack of food availability, to be able to take their treatment continuously, which means there's more virus floating around the world globally. The less virus exists, the less chance of transmission. So we need to interrupt transmission, one-to-one, one individual to another, and to support everybody currently living with HIV to get tested, get diagnosed, and stay on treatment.
Yeah, and in Ireland we're in the process of having primary healthcare centres throughout the country. There's a good few of them built in the last several years, and there are a lot more planned to be built over the next few years. So that's what we need in developing countries as well, isn't it?
Yes, well, actually, quite a number of the healthcare system in many developing countries, where I learned all about primary healthcare in Sudan, Cambodia, Mozambique, Rwanda, Burundi, Haiti, and other countries. In fact, many countries do support the primary healthcare system as advocated by the World Health Organization. Primary healthcare is extremely important in terms of health prevention and protecting health. Often I say in Ireland, we don't have a healthcare system, we have a sickness care system. You enter the system when you're sick. It would be so much better if the education system in Ireland and in all countries, along with the health system, supported people to protect their health through education and healthy lifestyles. A lot of illness can be prevented. Treatment is much more expensive than prevention. But sadly, in Ireland, we're learning now from many developing countries where Irish Aid, one of our important donors, is working in countries like Uganda, Kenya, Mozambique, Zambia, that, you know, the primary healthcare model is as important in Ireland and in Europe as it is in developing countries. First, health. Support people to protect our health. Health is our primary asset. Concern defines extreme poverty in terms of assets or lack of assets, risk and vulnerability to threats, and inequality. And we see health as people's primary asset in terms of survival. Today's International Disaster Risk Reduction Day. You know, a healthy person is better able to protect and reduce their risk to danger than a person who lacks good health. So we need to look at, particularly for children under 5s, the elderly population, people with disabilities, including people with chronic illnesses and those living with HIV, in all our emergency response and development work in the countries where we're working.
Yeah, you mentioned there Dr. Jack Lambert, his presentation as well to the meeting last month, the feedback session last month, and you quoted him. I was going to ask you about that, so you quoted him, so I won't ask you about that again. But and you were talking about the funding, and the UNAIDS wants 90% of people to be on treatment in the next 4 years, 3 or 4 years by 2020. Do we know how much increased funding is needed by 2020 to achieve the targets by UNAIDS?
Well, yeah, the last report that came out just before the replenishment fund has suggested that, unfortunately, the report is that international support fell from $8.6 billion in 2014 to $7.5 billion last year. $9 to $10 billion per year is needed. And unfortunately, UNAIDS estimates that 19 billion was available in 2015, but by 2020, 26.2 billion is needed to meet the global AIDS targets, to end the AIDS as a global public health threat by 2030. So we've a long way to go to fund and resource the response. Leadership, governance, and resourcing is critical. Otherwise, we will not end HIV transmission by 2030 and end AIDS by 2020. A lot more needs to be done. So on the next World AIDS Day on the 1st of December, I hope with our partners in the Dóchas HIV Working Group, Centre for Global Health, Irish Forum for Global Health, Mater Hospital, everybody involved, Trócaire Concern, it needs everybody on board to help people understand that AIDS is not over. I wish I could say the glass was more than half full, but from what I said, over 19 million people are still awaiting testing and treatment. The glass is not yet half full. The biggest danger to the global HIV and AIDS response, from my perspective right now, is complacency. It's not over till it's over. And just because people in northern countries, in the USA, in Ireland, in Europe, are not getting sick and dying from AIDS, doesn't mean it's okay that people in other countries with a different colour skin are getting sick, maybe not even getting tested, and dying before they reach a normal lifespan. They have every right to testing and treatment, the same as people in Ireland do. And I hope we can galvanise the global community with UNAIDS, with Irish Aid, with all our donors, and with the Dóchas HIV and AIDS Working Group to help people support and invest more, especially in prevention as well as in treatment. I really appreciate your interest in this, Darren, and your FM's support of the global HIV and AIDS response, and I hope you will join some of the events leading up to World AIDS Day this year on December 1st.
Right, thanks, Peter. Just a quick question before you go. The International AIDS Conference you're at in Durban, South Africa in July, the International AIDS Conference is held every 2 years, so it won't be held again until 2018. Do you know where it's going to be next time, and are you going to it again?
I do know where it is. They announced it in Durban, and it's not so far away, so hopefully we can get a big contingency from Ireland and from the countries where Concern is working, particularly to support and join the sessions in the Global Village. It will be in Amsterdam. And Amsterdam and the Dutch government, let me look here, is one of the main donors to the Global Fund in terms of the response. So I think Amsterdam and the Netherlands will host a very brave, visual, strong conference to highlight the fact that by 2018, AIDS will still not be over, and we will have a lot to do by 2020 to end AIDS, and by 2030 to stop the transmission of HIV.
Yeah, we had to have the funding has to be increased to necessary levels. Okay, Breda, thanks very much.